medicine for the prevention and management of obesity. Okay, I can't get my screen to move forward. Uh, There we go. So, our learning objectives for this session are to identify the role of lifestyle medicine in the prevention and management of obesity, to provide evidence based lifestyle recommendations for the management of obesity, and to apply critical thinking to problem solve weight management challenges. So, what is lifestyle medicine? So, I'm going to read this definition from the American College of Lifestyle Medicine. And lifestyle medicine is a medical specialty that uses therapeutic lifestyle interventions as a primary modality to treat chronic conditions, including things like cardiovascular disease, diabetes, and obesity. And a lifestyle medicine clinician is trained to apply evidence based, whole person prescriptive lifestyle change to treat and to, in some cases, when it's intensively used, to often reverse some chronic conditions. There are six pillars of lifestyle medicine, and they focus on a whole food, plant predominant eating pattern, physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections. And all of these provide effective prevention and management for chronic conditions. So, why is lifestyle medicine important in obesity management? Lifestyle medicine is important because it has to be, as we've talked about earlier today, it has to be about more than weight loss. It really has to be about the attainment of optimal health. And really, that's what our focus needs to be for our patients. We understand that being thin doesn't mean being healthy, right? And people can have sometimes people with higher weights don't always have health conditions. We know that higher weights do in and of itself may confer health issues, but we want to place our focus on optimal health and not thinness. And that's the important topic. Utilizing a patient centered, holistic approach to care can empower patients for long term sustainable weight management. And that's really the importance of lifestyle medicine. This will improve the quality of care that is provided, it can reduce healthcare costs, and ultimately, it can improve the quality of life of our patients. So during this presentation, we're going to work through a case. And so this is a 40-year-old female who presents as a new patient to the clinic for an annual wellness visit. She reports concerns about her weight because she has a family history of diabetes and thinks being overweight will increase her risk. She has no known medical problems and is not currently on any medications. She's interested in lifestyle modifications to manage her weight. She eats most of her meals outside of the home due to her busy work schedule. She has a sedentary lifestyle. She lives at home with her husband and two children. She does not smoke or drink alcohol and has no illicit drug use. So these are her labs and vitals and labs. On presentation, her blood pressure was 135 over 87. Her heart rate was 65. Her respiratory rate was normal. She has a BMI of 34. Her creatinine was 1. Her A1C was a little elevated at 5.8, but all of her other labs were unremarkable. So let's think about how would you help this patient create a lifestyle prescription for weight management. The lifestyle prescription can be created at one, but typically it's created over multiple visits. You really want to do what's going to work best for the patient. So when we think about nutrition, what would be the best? I'm just going to give you guys a moment to think about this. What would be the best dietary pattern for this patient? If you want to put a number in the chat, you can go ahead and do that. But what would be the best dietary pattern for this patient? We want to suggest a low fat, low carb dietary pattern. What about a high fat versus a low carb dietary pattern, a high fiber or a low fat dietary pattern, or a high fat, high carb dietary pattern for this patient? All right. Sorry about that. So, the best answer, and I can't see the chat right now, but the best answer is a high fiber, low fat diet, well, a dietary pattern. So you ask, well, why would this be the best? So this patient wants to both lose weight and also prevent diabetes. A high fiber, low carb diet. I'm sorry that my phone is ringing. Let me turn my ringer off. So, actually a high fiber, low fat diet will help her to achieve both her goals in terms of losing weight and also in preventing diabetes. Again, we want to remember that health is more than just weight loss. We need to look at holistic approaches to weight management that not only address weight, but also have a sustainable long-term strategy for disease prevention. So let's look a little bit about at plant-based diets. So this here was a literature review of plant-based diets for the treatment of obesity. There were 27 intervention trials and 6 meta-analyses. And the results showed that there was a 75% of these studies showed a significant increase in weight loss or decrease in weight in the intervention group when these patients were following plant-based diets. Other outcomes include decreases in energy intake, decreases in systolic blood pressure, plasma glucose, and A1C, total cholesterol, and LDL. Um, and also decreases in triglyceride levels and increases in fiber intake. The 6 meta-analyses showed weight loss, an average weight loss of a little bit under 3 kilograms, body mass index reduction, and improvements in A1C, LDL, and total cholesterol. So, in conclusion, this meta-analysis and literature review showed that plant-based diets result in significant weight loss and improved metabolic outcomes. And in looking at this, one of the things we want to consider is that plant-based diets may offer a sustainable approach to long-term weight loss maintenance. And so you want to make sure that you're having our discussions with patients should be open in regarding to their dietary habits, and we want to assist them in setting feasible goals for their weight management, for their lifestyle modifications. And also, we want to consider things like shared medical appointments that can maybe support patients in transitioning to things such as plant-based diets. These are some additional studies that some epidemiological studies that have examined differences in body weight based on dietary patterns. The Adventist Health Study showed that BMI increases as the amount of animal foods in the diet increases. And they showed that vegans had the lowest BMI, followed by those who followed a vegetarian, and then a pesco vegetarian, and then a semi vegetarian, and then an omnivorous diet. The EPIC Oxford study showed vegans gained significantly less weight as they age compared to omnivores, and that converting to a more plant-based diet also appears to be protective against weight gain, as does following a pesco vegetarian diet for women. The EPIC Panacea study found a positive association between total meat consumption and weight gain, even after adjusting for energy intake. And then the Swedish mammography cohort found that omnivores had the highest prevalence of overweight and obesity compared to individuals following dietary patterns with less meat. There are other studies such as the New Diet Study, the Her Health Study, and the VA Beach Diet Study, which all reported significant weight loss among individuals who are prescribed a plant-based diet. Now, one of the things we have to think about with epidemiological studies is that they establish associations and not causation. And then we also have to keep in mind that the quality of the diet matters. We know that when individuals can definitely follow a plant-based diet, but not be following a healthy dietary pattern. Like French fries are a plant-based food, but it's not a whole food. And so remembering that quality of the diet matters when prescribing dietary patterns. Well, what about Mediterranean diets? Well, Mediterranean diets also emphasize plant-based foods, and they also have room for healthy fats and lean proteins. There was a meta-analysis of 16 randomized controlled trials that included a little over 3,000 participants and found that those following a Mediterranean diet had a significant weight-lowering effect and that it reduced the BMI compared to controls. The effect of the Mediterranean diet on body weight was larger when it was combined with energy restriction, increased physical activity, and follow up longer than 6 months. And another meta-analysis of 9 randomized controlled trials among a little over 1,000 patients with diabetes showed that the Mediterranean diet led to a greater reduction in hemoglobin A1C, fasting plasma glucose, fasting insulin, BMI, and body weight versus controls. Similarly, the total cholesterol and triglyceride concentrations were reduced and HDL was increased. So we know that following Mediterranean diets can also have benefits in terms of improvements in weight management and other metabolic factors. And partly because Mediterranean diets also have a plant predominant focus. Well, what about when you think about plant-based diets versus Mediterranean diets? So, new data from a previous trial that was conducted by the Physicians Committee for Responsible Medicine found that when overweight participants followed a vegan diet, they lost an average of 13 pounds and they had a 73% reduction in these advanced glycation products. Advanced glycation products are just harmful substances that form when proteins or fats combine with sugar in the body, and they can often lead to chronic inflammation. And these advanced glycation end products can form either during cooking or during reactions that occur in the body. The participants they found in the study on the vegan diet also had improvements in total and LDL cholesterol levels and in insulin sensitivity. The largest dietary sources of the advanced glycation end products were meat, added fats, and dairy products. So here we see that here's just one study that was showing that plant-based diets might be a little bit more beneficial than Mediterranean diets in some instances. Well, what about ketogenic diets? So, a systematic review and meta-analysis showed what that had a total of 23 randomized controlled trials that corresponded to 17 clinical investigations, showed that low carb diets had positive effects on body weight, BMI, abdominal circumference, blood pressure, HDL, triglycerides, A1C, insulin, and C-reactive protein. What they also found, though, is that these benefits are often transient, and the effects are generally not seen after 12 months of therapy. They can improve HDL, but also increase LDL. So that's something to think about when patients are thinking about or asking about these ketogenic diets, that they will have some short-term benefits. The long-term benefits are yet to be seen, but also knowing that there are some potential increased risks for increasing cholesterol levels and also which may lead to increased cardiovascular risk. And the dietary restrictions on a ketogenic diet may not necessarily be sustainable. So, one of the things I wanted to talk about is talking about why things like Mediterranean diets, plant-based diets, with their focus on more plant-predominant foods, might be helpful for patients when we're thinking about weight management strategies and also thinking about health. Because remember, we're not just thinking about how to help our patients lose weight and manage their optimal weight, but we're thinking about how patients should have optimal health. At whatever size that they are, we want to make sure that patients are having optimal health. And so I want to talk a little bit about fiber and its importance in weight management. So just a little bit of background that I'm going to go through in the next couple of slides, but there are two types of fiber. They're soluble and insoluble. Most foods have a combination of both. Increasing the intake of fiber, which is an undigestible carbohydrate, it offers numerous benefits in weight loss and chronic disease management. High fiber diets can help regulate blood sugar and lipid levels. They can increase satiety, they reduce inflammation, and they aid in weight management, and they can reduce premature mortality. You may have heard of something called resistant starch, and it's a type of carbohydrate that resists digestion in the small intestine. And so it pretty much acts just like fiber. It provides fuel for the gut microorganisms, and both fiber and resistant starch, which are very similar in how they act, they're fermented in the gut into these short chain fatty acids. And these short chain fatty acids have a lot of benefits in terms of weight management and also in terms of just overall health benefits. So fiber resist and resistant starch and weight management, what is their impact? So fiber can result in delayed gastric emptying. And we know that delayed gastric emptying can increase satiety and can help with appetite regulation. It can also assist with blood glucose control. Fiber also helps to promote a healthy gut microbiome and can reduce inflammation in the gut. And that also can aid in weight management. Fiber and resistant starch, they produce, again, these short chain fatty acids. And they can also metabolize energy of mixed diets by blunting the digestibility of things like protein, total fat, and they and certain short chain and short saturated fatty acids, sorry, and increased fecal energy excretion. So fiber and resistant starch can really help to not only promote satiation and help to promote good healthy guts and reduce inflammation, but they can also themselves help to metabolize energy by impacting how other macronutrients are also digested. So fiber and satiety, this is a couple of other studies that show that fiber can be associated with stimulation of satiety hormones, reduce hunger, decrease energy intake, and weight loss through the stimulation of appetite regulating hormones, such as CCK, as we talked about earlier, GLP-1, and peptide PYY, both in rats and in humans. There was a study that reported that although these appetite, just as a note, there was a study that reported that although these appetite regulating hormones are stimulated, there was no reported change in satiety among participants. So there's some mixed results, as we know that fiber can impact these hormones, but there are some mixed results as whether or not people actually report satiety when they eat certain types of foods and these hormones are being stimulated. And that may be due to a lot of other different factors, a lot of other metabolic factors at play in the specific individual. This is the gut microbiota help to break down dietary fiber to produce these short chain fatty acids. And these short chain fatty acids can stimulate increases in the release of gut hormones such as PYY and GLP-1 from the L cells of the colon. And the increased levels of GLP-1 and PYY, as we talked about earlier, can decrease gastric motility, so they can slow gastric emptying, and they can also reduce pancreatic secretions. The release of gut hormones also inhibits neuropeptide Y and the agouti-related protein neurons. And we talked about those earlier in the first session. And they can also stimulate the POMC neurons of the CNS and reduce appetite. So the stimulation of the fiber being broken down into these short chain fatty acids, this hormonal signaling through the short chain fatty acids can increase the appetite regulating hormones, PYY and GLP-1, and they can also inhibit those appetite stimulating hormones in the central nervous system. Soluble fiber can also decrease leptin secretion via decrease in fat mass. And also soluble fiber may improve adipokine levels by decreasing the way that fat is broken down in the liver and adipose tissue. And besides also soluble fiber can also decrease leptin levels by improvement of leptin resistance. Remember, as we talked about earlier, that in obesity, there is an increase in leptin, but there's also leptin resistance. And so fiber can help to decrease those leptin levels and also and improve through the improvement of reducing, leptin resistance. So for this patient, when we think about nutrition and we're forming a lifestyle prescription for this patient, one of the things we may want to focus on for this patient is incorporating more fiber into their diet. We can think about like the 5 a day. So aiming for 5 servings of fruits and vegetables, eating more whole grains, more nuts and seeds and legumes, and limiting fats to less than 5% of their total daily caloric intake. And also specifically helping them to understand to limit those highly processed foods and refined sugars. Because again, we're aiming for this patient to not only help them with their weight reduction, but also to help them with reducing their risk for diabetes. So let's think about what the patient's still in your office, or the patient comes back and the patient mentions that she hasn't been exercising much and she wants to know what exercises she can do for weight management. So, what are the best exercise recommendations to give this patient? Just going to give you guys a minute to just think about this question. And the best recommendations, one, we want to remember that when we're thinking about exercise, is to consider whatever the patient enjoys to do, whatever, if they have any physical limitations. And we want to make sure that our exercise recommendations are going to be centered and specific to the individual. The American guidelines, American Physical Activity Guidelines currently recommend that adults engage in moderate intensity exercise for at least 150 minutes a week with at least 2 to 3 days of resistance and strength training. So what we know about exercise and weight management is that exercise increases energy expenditure. It also has direct anti-inflammatory effects, and it can improve metabolic markers such as body composition, physical fitness, lipid and glucose metabolism. It also improves cardiopulmonary health. It can strengthen bones and muscles. It improves glucose regulation and insulin sensitivity. It improves cognitive functions and reduces stress and improves mood. So exercise is really important. We want to be recommending that for our patients for their overall optimal health. Well, what about exercise and satiety hormones? Well, this was a study that showed that acute, moderate to vigorous intensity land-based exercise, which suppresses subjective appetite feelings, also suppresses those appetite stimulating hormones of ghrelin, and the acylated ghrelin is the active form of ghrelin in the body. It also increases those appetite suppressing hormones, PYY and GLP-1. So exercise itself can help to regulate some of these satiety hormones as well. These changes were transient, and hormone concentrations usually return to resting values in the hours after exercise, without, though, evoking compensatory increases in appetite or energy intake on the same day. The degree of appetite suppression can vary, although between individuals. So we have to remember that there are many factors which stimulate or suppress appetite, making again a comprehensive approach to care even more important, but helping patients to understand that exercise can help them with appetite suppression and energy expenditure. This was a study of a meta-analysis of 116 randomized clinical trials that involved over 6,000 adults with overweight or obesity and found that levels of body weight, weight circumference, and body fat decrease linearly with increasing duration of aerobic exercise at moderate to vigorous intensities to 300 minutes per week. And so aerobic exercise of at least 150 minutes per week was associated with clinically important reductions in waist circumference and measures of body fat. So this is consistent with the physical activity guidelines for Americans, which recommend at least 150 minutes of aerobic exercise per week. With this meta-analysis showing that uh, even increasing that closer to 300 minutes a week also provides added benefits in terms of weight loss and other metabolic factors. So as we continue to build this lifestyle prescription for our patient, we thought about nutrition. Now we're in eating more high fiber foods, less fatty foods, less processed foods, less refined sugars. Now we want to think about physical activity, and we might want to engage. We might want to our prescription for this patient in terms of physical activity might be engaging in 30 minutes of moderate intensity exercise, things of where they can talk but they can't sing, such as biking, power walking, running, 5 days a week, plus 2 to 3 days of resistance and strength training. And again, this resistance and strength training is really important for many different reasons. One, for helping in terms of promotion of weight loss and maintenance of optimal weight, but also it's important in ensuring that there's not loss of lots of muscle mass as people are losing weight. So that resistance training is really, really important. It's something I really emphasize in all of my patients to make sure that they're engaging in resistance and strength training. They can use bands, they can put some ankle weights on, they can have hand weights, they can lift jars of food. So different ways that we can try to encourage our patients to engage in physical activity that includes resistance and strength training. And again, individualize it to the patient, making sure that the activities that are recommended are something that they will engage in and that they can physically engage in. So what about sleep? What are your sleep recommendations for this patient? Do you want this patient to take some naps during the day? Do you want this patient to sleep 7 to 9 hours at night? Do you want this patient to eat a small snack before sleep to help her improve her sleep quality? Or do you want her to get a lot of sleep and sleep 9 or more hours per night? So you want this patient to sleep 7 to 8 hours per night. Most studies show that that's the optimal amount of sleep to get per night. And it's important to really help our patients to understand the importance of sleep, not only to weight management, stress management, but to their overall optimal health, and really encouraging our patients to look more at their sleep patterns and helping them with any barriers to getting good sleep at night. So, eating and sleeping at unconventional times was associated with a higher risk of obesity and an unfavorable metabolic profile. Deprivation can also increase inflammatory markers. And so so sleeping less than 6 hours is not good, but also sleeping more than 9 hours per night can also be detrimental. So we want our patients to try to get an optimal of 7 to 8, definitely not getting more than 9 and not getting less than 6. A higher prevalence of obesity and cardiometabolic dysregulation has also been seen in people who work night shifts. And in those who changes in their sleep may change differently on the days that they're off versus the days that they are working. And so it's important to think about sleep deprivation because shorter sleep duration can be associated with higher energy intake and mainly due to increased consumption of saturated fats, resulting in weight gain and an increase in BMI. It's also associated with poor eating habits, including an increase in meals, snacks, nighttime eating, and also can be associated with consumption of more high energy foods, lower intake of fruits and vegetables, and higher intake of fast foods, refined sugars, and fats. And again, which can result in increased overall energy intake and increased BMI. A study demonstrated that increasing obstructive sleep apnea severity was also associated with lower GLP-1 levels, a response to a glucose challenge. So this is probably noting that higher increased severity of sleep apnea was associated with lower GLP-1 response is probably why we've seen more of the use of GLP-1s for the treatment of sleep apnea. And I know we're going to talk more about drugs later on, medications later on this afternoon. So I like to tell my patients sleep more, and that will help them again with their weight management. During sleep, leptin levels will normally rise, increasing satiety. So the more they sleep, the more they're going to have better regulation of those leptin levels. Sleep deprivation, however, though, can increase ghrelin levels and can lead to increased hunger and appetite, which can increase food consumption. Also, sleeping less can cause more inflammation. I try to help my patients to understand that, sleep is like when your body does its housekeeping functions. And so if you didn't clean your house for a long time, your house, of course, would be messy. That's what happens when we don't sleep appropriately. When we have shorter sleep duration, it doesn't allow our body's time to do its housekeeping functions. We're going to have more inflammation, and it's going to increase our risk for poor eating behaviors, more dysregulation in our hormonal levels, and changes in our energy expenditures. So for our lifestyle prescription for sleep, we want to encourage this patient to sleep 7 to 9 hours per night, and also to encourage the patient not to eat at least 3 to 4 hours prior to bed, because eating before sleep can also disrupt the quality of sleep that people will experience. So this patient now mentions that she has a lot of stress, which makes her feel depressed at times. And she thinks that these stressors might prevent her from implementing the previous recommendations that we gave her for her lifestyle medicine prescription in clinic today. So let's think about stress and weight. So chronic stress causes inflammation and changes in hormonal levels such as cortisol, and can increase risk for chronic diseases such as obesity. Chronic stress also impacts dietary choices and exercise and sleep regularity. A weight stigma also plays a major role in self-esteem and body image, and can impact overall wellness and mental health. As we discussed in previously, it's important to be mindful of the language that we use and help patients understand that obesity is a medical condition and it doesn't define who they are. We want to always encourage a positive self-body image. And again, really our language should be around, we want to promote health. And health is what we want our patients to focus on. I always tell my patients, I want you to be healthy, because again, thinness doesn't relate necessarily to health. I want to be concerned about how not only weight management, but I want to be concerned about the prevention of disease and the maintenance of optimal health. So, with stress management, you want to identify stressors, which can be barriers to implementation of lifestyle modifications. And you also want to suggest healthy ways to manage that stress. Things such as biofeedback, which is a technique that helps individuals gain awareness and control over their own physiological processes like their heart rate, their muscle tension, their skin temperature. And they do this through visual or auditory feedback. Other things such as prayer, guided mindfulness meditation, exercise, massage, gratitude, journaling, music. These are all ways that you can suggest our patients to help them with their stress management. So again, in adding to our lifestyle prescription, we might want to suggest this patient incorporate daily stress reduction activities such as exercise, deep breathing, time management, and positive self-talk. Um, we want to discuss these stressors with patients and also help them find ways to mitigate the negative impact of the stressors in their lives. And this may also include a referral to a behavioral health specialist. So that may be a part of this lifestyle prescription in helping our patients to more effectively manage their stress. Social connections, which is another pillar of lifestyle medicine, is also important. Social connections and relationships affect our physical, they affect our mental and emotional health. And research shows that the single most important predictor of human happiness and long life is having strong social connections. We also have to remember, though, that social connections can have both positive and negative influences. The social connections that you have might influence more different types of stressors or different types of dietary behaviors or different types of exercise behaviors, whereas other social connections might have more beneficial impacts on all of those behaviors. So the importance is helping our patients to form positive social connections that's going to benefit them in positive ways, have positive, benefits on their physical, mental, and their emotional health. And this may be through volunteering, joining community groups, joining a religious or a spiritual group, going to a sports event or a music event, um, attending community celebrations, taking a course, doing things that just allow them to engage in positive social connections. So, for social connections, as we again build our lifestyle prescription, we want to encourage our patient to connect with others on a weekly basis in an enjoyable activity that's going to help promote all of the other lifestyle uh, modifications that they're trying to make in their life. Well, what about avoidance of risky substances? So there's mixed data on the association of alcohol and obesity. But what do we know? We do know that chronic alcohol intake can impact overall health and lead to chronic medical conditions. It can also cause dangerous pro-inflammatory compounds and free radicals. It can be toxic to the liver. It can degrade the intestinal mucosal barrier and also gut the microbiome. And can also, alcohol is calorically dense and also nutrient poor. So although the data may be mixed, there are some things that we do know that may be helpful in how we counsel our patients in regards to weight management and also chronic disease management. So as we think about, again, adding to our lifestyle prescription, we want to encourage this patient to avoid alcohol use due to its increased caloric density and to minimize the health risks. And then for this patient as well, the alcohol use can increase their risk for diabetes. So now that you've built your lifestyle prescription with this patient, focusing on the previous pillars that we discussed, and now the patient tells you that she wants to implement the instructions and the recommendations that you gave, but she also needs some additional advice on how to choose healthy options because she doesn't have a grocery store in her neighborhood. The grocery store In order for her to get to the grocery store, she has to travel a few miles. And also, she can't go out to exercise due to safety concerns in her neighborhood. So when we're thinking about obesity and chronic disease management, we want to think about social and structural determinants of health and how they impact our patients. Not only how they impact their formation of chronic diseases such as obesity, as we discussed earlier, but also how do they impact their ability to implement the recommendations that we give them. We've got to think about their environments. We've got to think about the impacts of healthcare access and quality and economics. We got to think about the things such as racism and discriminatory policies that might cause more stressors. We got to think about the environment in which they live. Do they have safe spaces to exercise? Do they have access to different types of treatments for obesity? And also, are they in a place where there's food deserts, or maybe they have access to foods, but they have more dollar stores, like I mentioned earlier, and so the amount of nutritious foods might be limited. How do we talk to our patients and help them through these social and structural determinants of health? Some of the things we may want to do, the patient population that I work with may come from some of these environments where they don't have a lot of grocery stores in their neighborhoods, or they may have more alcohol outlets in their neighborhoods. So one of the things that I might counsel them on is how can they find the easiest options within those locations. Like beans are cheap, and rice is cheap, and they don't have to get fresh vegetables all the time. They can get frozen vegetables, and they can even get canned vegetables, because nowadays more canned vegetables are being made without sodium, which is even better. And so I really think about the environments in which they live, and I make recommendations specific to those environments, because I still want them, again, to have optimal health. If they can't exercise at home, outside, how can I give them exercises and activities they can do at home? Now they can do, YouTube has different exercises, or there are different exercises that I may just be able to talk to them about in the clinical visits that they can do within the context of their home. Maybe they can just walk around their kitchen, or walk from their bedroom to their living room, or walk up and down their stairs, but finding ways in order to be able, excuse me, to combat any barriers that our patients may be experiencing that might limit them from being able to implement the suggestions that we are giving them. Other things that we can tell them, things like meal prepping. If this patient, she's busy, she has a family, she may be working, how can she meal prep? How can she make multiple meals at one time, or eat or make do meal batch prepping, where she's prepping multiple different meals at the same time that may carry her for a few days throughout the week, her and her family. And so we want to, again, be thinking about practical strategies to give our patients for how they can implement things. Lifestyle medicine should not be something that everyone cannot have access to. These strategies should be practical, simple, and accessible for everyone, again, to promote optimal health. And so some key points from this lecture are that we want to have term sustainable weight management, and that should include lifestyle modifications. No matter whatever else we're going to recommend, even if our patients end up needing medications, or end up needing weight loss surgery, they are not going to be able to have long-term sustainable weight management without incorporating lifestyle modifications. And so it's important that we always stress that the lifestyle modifications are important for that whole person holistic care. Because again, remember, health is the goal. That is our goal, for our patients to have optimal health. And lifestyle modifications should be individualized and practical for improved patient adherence. Thank you so much. take any questions and I'll
Thank
stop
you so
sharing.
much, Dr. Wells. I appreciate the presentation. We do have some questions for you before we break for lunch. How do studies execute a plant-based diet? And do those include plant-based meat substitutes?
So, when you look at the different studies, they're going to be different. And more so, you're going to have better outcomes when there are more intensive um, strategies to incorporating especially the nutritional components and exercise components. So sometimes they'll have some of these studies may have meal preps where they're prepping the meals for the patients and giving them the specified the meals to eat throughout a specified time. Sometimes some of these studies are encourage them to just eat more plant predominant foods, especially those that are higher in fiber and lower in fat. Um, I would say that none of the studies that I have probably looked at have had the plant-based meat substitutes, um, probably for various reasons, because more of these studies probably focus on whole plant foods versus more of the processed plant-based meat substitutes.
Great, thank you. Our next question is, what about smoking cessation? Is that important to weight loss?
I was looking about smoking cessation and I didn't really see there may be, so someone can educate me on this, but I didn't really see any direct correlations between smoking and weight loss. But we know that smoking can be inflammatory. And so smoking can lead to other conditions that might be contributory to the formation of metabolic syndrome. And so there's probably an indirect relationship between um, smoking and maybe weight.
Thank you. The next question is how to approach medications the patient is taking and may be associated with a struggle in weight loss, such as beta blockers or SSRI, etc.
Right, and I know we'll probably touch a little more on this during the afternoon session on medications. But I think what I would say is that there are times where, and now that I've been certified in obesity medicine for a little bit, I'm more aware of what medications my patients is taking and thinking about, is this a can I switch to an alternative? And if I can't switch to an alternative, just again, emphasizing the importance of lifestyle modifications and understanding again that there are going to be some barriers that the patient may be facing if and one of them might be the medications that they're taking that might be contributing to that weight loss. But ultimately, if I can get that patient off that medication, that would be the goal.
Wonderful. Thank